So today we're going to discuss lateral lumbar flexion. So the biomechanical explanation is that as the patient laterally side bends, movement will be limited by the facet joints at the lumbar spine, as well as ligaments checking the side bending. Normal side bending for the lumbar spine is at 25 to 30 degrees. As the patient laterally flexes to the right superior and inferior facets move posterior and inferior, and the left superior and inferior facets move anterior and superior. The indications for performing lumbar lateral flexion are limited movement in the lumbar spine, and contraindications include but are not limited to pain, spinal injury or surgery precautions, rib fracture, other dislocation and fractures in the area, currently taking pain medications or muscle relaxants, osteoporosis, and or pregnancy. The test psychometrics, inter-rater reliability is moderate to high with interclass correlation coefficients 0.62 to 0.91, and intra-rater reliability is about 0.76. Validity is poor in comparison to measurements obtained from röntgenograms. For the procedure, the patient should be standing up straight in their normal posture. The therapist will palpate for and place the axis of the goniometer at the spinous process of S1. The stationary arm should be perpendicular to the floor, and the movable arm should be aligned with the spinous process of C7. The therapist should instruct the patient to laterally flex while keeping their shoulders stacked in the frontal plane and reach with their ipsilateral arm towards the knee. The therapist should also instruct the patient to stop if pain occurs or if the shoulders move out of the frontal plane. The expected outcomes of this lateral lumbar flexion, so the normal range of motion is about 25 to 30 degrees again. So today we're going to have you do side bending of your trunk. We're going to measure that. So the purpose of this test is to get an objective base measure, so we know where you're starting at and we can measure your progress from there as we go on with our physical therapy sessions. Sounds good. Sound good? Alright, so I'll have you stand up. And then I'm just going to feel around your low back for your first sacral vertebra. And that's where the middle of my goniometer is going to go. The stationary arm will be pointed at the floor. And then I'm just going to feel around the base of your neck for your 7th cervical vertebra. And then if you could just look up to the ceiling for me so I can confirm. Perfect. You can put your head back at neutral. Alright, and that's where my movable arm is going to go. So when I tell you to, you can bend over towards your right side, kind of reaching towards your right knee or the floor with that right hand, and keeping your shoulders in the same plane as if you're squished between two buildings and can't move forward or back. If you feel any pain, let me know and stop. Sound good?
Sounds good.
All right. Whenever you're ready, you can bend to your right. Perfect. And come on back up. That was 30 degrees. So if we were doing the left side, we would just have her bend the other way, and we would measure it the exact same way.